So Bob, I'm so happy you're here because you have had decades as an expert in the healthcare space. And of anyone we've interviewed, I think you're really uniquely positioned to offer your perspective on the changes in healthcare going forward. What do you think the big trends are?
Well, Patty, I think that there are two major matters that are driving change in the healthcare industry today and will continue to. The obvious one is the Affordable Health Care Act, lovingly known as Obamacare. That the law as it's written and the regulations as they are presently written and continue to be written as we speak are going to impact every facet of every type of provider's operation. Whether it's a physician, a hospital, a health system, a clinic, a lab, a pharmacy, they're all going to be impacted by that law and how it gets implemented. And that starts in earnest next year. And what I mean, I guess, simply stated as I can, is that the revenue model for all these aspects, all these types of providers is indeed going to change. In addition, it's going to impact every facet of how an employer, and some of these providers are employers as well as non-provider employers, are going to be able to make decisions on their employees' health care benefit programs, the levels of the benefits, the cost of the benefits, how they're administered, et cetera. And finally, it's going to impact every aspect of a payer's or insurance company's, health insurance company's operations, from the way they operate to their products and as well as their pricing. The second major matter that is driving change today and will continue to, I believe, is that today there's a serious move, somewhat prompted by Medicare, CMS, and this legislation, but not totally. There's a serious move to something called outcome-based provider reimbursement. Now, as opposed to what we know today as fee-for-service provider reimbursement, where the providers are reimbursed or paid for their services based upon the volume of services they provide, outcome-based reimbursement incents a provider based upon the health outcome of a specific population that provider operates for, a specific population of patients. And that health outcome is determined by a set of metrics that are agreed upon in advance between the payer and the provider, or the providers. And those metrics are directed at mitigating the negative impacts of the 3 chronic diseases, as well as asthma, et cetera, as well as helping to prevent the occurrence of those diseases, and as well wellness. So that's a whole move which will also incent providers to take on more risk. When they're incented and paid and rewarded based upon health outcomes, hopefully positive health outcomes, then they're going to be taking on more risk.
So how will Alliance Healthcare Advisors address these changes in healthcare? What services will you provide to help your clients?
We bring help in the sense that after having assessed the particular situation of the provider or the employer, in this case, either way, after assessing the situation, to walk the provider or the employer through the decision tree as to whether they're going to comply or not comply with the law. You don't have to comply if you choose to pay a penalty. Those numbers need to be run. We bring as well I bring a lot of experience to the employee benefit package program spectrum, so that we can help there. And as well, something I'll call organizational strategy. This is primarily directed at physician practices who have some major decisions to make as to whether they're going to try to stay independent, whether they're going to align themselves with the hospitals one way or another, either being acquired, joint venture, accountable care organization. We help the physicians in the practice walk through those models so that we come out with the tailored solution that's best for them.
Sounds great. And you have, I know, expanded your business to include international business. Tell us a little about what you're working on in Panama.
Yes, well, I have a client down in Panama that is a big insurance company. It's been around for many, many years there, but it has for the health book, it has a Blue Cross Blue Shield license, which I help that insurance company negotiate with the holders of the Blue Cross Blue Shield license. And they've been my client for the last 7 years, and I help. It's different down in Panama because they have a public program as well as private insurance, and I help them with product, with pricing, and with the health of the book.
Sounds like a great engagement. Now, when you're not busy with work, which I can hardly imagine could ever be the case, what do you like to do for fun?
I enjoy my 2 grandchildren very much, to tell you the truth. One's 8 and one is 5, and when they don't live in this area, but they're not too far, so when they come and visit, and that's coming up in another couple of weeks, I have to get my rest, get ready for that. It
sounds like you do. The 8-year-old and the 5-year-old will keep you hopping.
A lot of fun.
Well, thank you so much for
My
joining
pleasure.
us, and good luck with your business.
Thank you so much, Patty.